patient is suffering from pain of migraine. So the pain of migraine is usually unilateral. It may be bilateral, but usually unilateral, associated with nausea and vomiting. And because this patient is covering his eyes, so a pain which is having photophobia as well as phonophobia. It may or may not have aura. Now understand, this pain can last for hours, but it resolves within 1 day. So it is called as 1-day illness. This pain causes disability, not able to go to work, and the patient wants to sit down in dark and relax. So the patient will have a pain which lasts less than 1 day, a unilateral pain associated with nausea and vomiting. The character of the pain is pulsatile because the pain has origin in the vessel.
So one of the accepted theory of pathogenesis of migraine is that irritation of trigeminal nerve releases a plethora of neurotransmitters. One of them is CGRP, calcitonin group related peptide, which causes vasodilation of the dural blood vessel, causing pain. This pain can be reduced if we either cause vasoconstriction or decrease of CGRP. For acute attack of migraine, mild cases we prefer NSAIDs, but for moderate to severe cases we give sumatriptan. Sumatriptan, or the triptan group of drugs, how do they act? Is that they act presynaptically reducing the CGRP and postsynaptically causing constriction of the dural blood vessels, thus decreasing the pain. You can also use propranolol and calcium channel blocker for constriction of the blood vessels, but these drugs are used in prophylaxis of migraine. Tricyclic antidepressants and anticonvulsants are also useful. So this patient is crying with agony and suffering from cluster headache. So why this cluster headache is known as cluster headache? It is because it is clustered around some weeks in a year. That is, some episodes occur in in a month, and then there are no episodes. And these episodes are of a short duration, 15 minutes and maximum of 3 hours. And this pain is unilateral and very, very severe. It is so severe that if it goes untreated, the patient commits suicide. So this is a graph showing the severity of the headache. And along with this pain, there is a unilateral overtone. That is, there is lacrimation and rhinorrhea along with meiosis and lid drooping. As compared to a patient of migraine which lies quietly in the bed, this patient has agony and he is restless with pain. For treatment of cluster headache, this patient has been given 100% oxygen, and we can also give sumatriptan or triptans, which is given in migraine. For prophylaxis, we use verapamil.